Hi, I'm Mahesh Jaraman, acupressure therapist, health counselor, and co-founder of Sepalika.com. One of my other podcasts was on heart attacks and how these are not caused by blocked arteries. This is based on the work of cardiologists Dr. Nutz Roca in Germany and Dr. Thomas Cowan in the US. These are doctors who are part of a growing band of MDs who are beginning to look for the real reasons for heart attacks, including something called loss of heart rate variability, which basically translates into having too much stress without having enough release. So if that's the case, why is this podcast focused on new techniques to open up arteries? After all, if blocked cardiac arteries don't cause heart disease, why should we worry about opening up new arteries? Well, there are two reasons. Number one, conventional treatment uses stents and bypass surgeries to open up large cardiac arteries. We believe that is not needed since nature builds bypass arteries by itself. These are really thin new arteries which literally bypass any blocked artery and continue to supply fresh blood to the heart. But then, this does not mean that we can't give nature a helping hand, especially if the way we do this is non-invasive, is effective and is safe. Number two, if you have diabetes or chronic inflammation, which most people with cardiac concerns often do, that will eventually deteriorate your small blood vessels, the thin capillaries, the extra ones that nature made, reducing this built-in protection. So again, if we can help nature speed up the process of opening up new capillaries in a safe, non-invasive way, it makes sense to do so. That's exactly what enhanced external counterpulsation or EECP is. It's a Medicare insurance approved therapy, and studies show that EECP alone will relieve you of about 80% of angina. Now this is how EECP works. You go into the clinic and you lie down. Pressure cuffs of the kind that are used when measuring your blood pressure, those are fixed onto your thighs and to your calf muscles. When your heart is in the relaxed part of the beat, the diastole, the balloons will inflate, squeezing the blood. This opens up tiny capillaries which would have otherwise laid dormant. The inflation of the cuffs is synchronized with your heartbeat through an EKG machine, so the procedure is very safe. Rather than bypassing one or two large arteries by using bypass surgery or stents, through EECP you can create thousands of new capillary beds that supply even more blood than the bypassed vessels can. Each session is about an hour long and you need about 35 sessions to benefit properly. It has insurance approval for angina in most parts of the world. The effects typically last for anywhere between 5 to 8 years. The only people in whom new collateral vessels open up to supply blood to the heart without any EECP is in extreme endurance athletes. Those are the folks who are running the triathlons or the marathons. So EECP is an amazing way for heart patients to receive the cardiac benefits of extreme endurance exercise while lying down all the time. There are exceptions though. If the angina is unstable or if the blockage is in the proximal LAD artery, EECP is not recommended. But barring these, most other angina patients, especially those with other chronic diseases like diabetes, should consider EECP seriously. Empower yourself with this knowledge and speak to your doctor today. Wish you vibrant health and well-being.